In this segment, we're going to overview bag valve mask use. In this particular bag valve mask, you'll notice that there's not only a reservoir on the end of it, there's also oxygen tubing, and for good reason. It needs to be attached to oxygen, supplemental oxygen, high flow O2, in order to deliver the maximum amount of oxygenation to the patient when using this tool. We're going to connect this end to an oxygen nipple. We're going to plug the outlet to the bag valve mask and allow this reservoir to fill, and at that time it's now ready to deliver close to 100% oxygenation to the patient as long as we have a good seal around the mouth of the patient. Remember that one of the biggest problems we have is thinking we're ventilating the patient, but we don't have a good seal, air is escaping out the side of the face, and if that's happening, we may want to consider going back to a simple mask, rescue breathing, using a one-way valve CPR shield. And I always caution my students about that. If this isn't working for you and you're not in good practice, skip it. Put it to the side, grab a regular one-way valve CPR shield and use that. You'll get a better seal and better delivery of oxygen even without supplemental oxygen than you would with a bad seal. If you don't have supplemental oxygen, you may want to revert back to a bag valve mask system where you can basically take off the reservoir and simply use room air. 21% oxygen is great. We can deliver that oxygenation to that patient in respiratory arrest or respiratory distress and not have to worry about desatting the patient because we're drawing off from a collapsed reservoir and not getting them any oxygenation. We're going to simply attach the bag valve mask to the face shield for an adult and for a child. We'll take the large one. If it's an infant or a pediatric child, it's going to receive this size bag or this size mask. And it's important to get the right size mask with the right size patient. When we demonstrate how this works on a real patient in just a few moments, remember that we use the CE technique of sealing the mask. It's a very uniform way of doing it. The thumb and first finger will come in at an L, seal over my right side of the mask to cover over the patient's right side of the face, while the E, or the middle, ring, and pinky finger are going to reach around to the mandible of the patient and draw the chin and face up into the mask. It's important to remember we're not pushing the face mask into the patient, we're drawing the jaw and face and head of the patient into the mask to assure a good seal. And then in this position, the person who's providing the rescue breaths can utilize their leg, if their hands aren't big enough or strong enough, to actually assist them in getting a full, slow, steady squeeze, one breath every 5 to 7 seconds. We're going to show this in a demonstration mode in just a moment.